Knock, knock. Hi, Sammy. My name is Morgan Quinlan. I'm the PA student working with PA Jar today. How are you?
Good, how are you?
Great. Do you have any questions? Oh, well, I should probably say what we're doing today. We're going to be doing a cardiac exam. Do you have any questions or concerns before we begin?
I don't.
Okay. Well, before I begin, I'm going to wash my hands. All right, and you're already nice and high up on my exam table. That's great. So the first thing I'm going to do is inspect the anterior chest. I'd be looking for any abnormalities noting symmetry. I would also probably do this with a pulmonary exam, so I'd be looking for any other chest abnormalities. And then I'd be looking for any ventricular motion that would be potentially protruding through your chest. And I don't notice any of that, so we're going to move on to the next thing, which is I'm going to locate, palpate, and estimate the diameter of the PMI. So in order to do this, I think it'd be best if I had you lay supine or flat. So what I'm gonna do is I'm gonna locate your mid-sternal or the suprasternal notch, about 2 intercostals down. And then I'm gonna go over to like the mid-clavicular line, and I gotta get to the 5th intercostal, which is a little more difficult. And I'm palpating and feeling for that pulse. Let me know if I'm hurting you.
No, you're good.
I feel a faint pulse here. It's pretty close to the mid-clavicular line. And it feels a little bigger than a dime size, but smaller than a quarter size. So that is what we would expect. So no abnormality there. And then I'm also going to measure the distance. I'm going to go back and do that. Measure the distance of that from the mid-sternal location that we were at. So I'm going to start down here again. Cross over. It's about mid-sternal. And I'm going to go 2nd, 3rd. Glad you brought your support animals.
I was going to say, I'm sorry, my support dog is in the way.
Okay. That's pretty in line. I would say it's maybe 1.5 centimeters lateral to the mid-clavicular point. So nothing too abnormal there. Nothing abnormal, let me clarify there. So the next thing we're gonna do is some palpation. So I'm gonna palpate the aortic area, the pulmonary area, the tricuspid area, and the mitral area. I'm also gonna bring my notes with me because I'm not super familiar with this yet.
That is fine.
So I'm gonna find the suprasternal notch again, the 2nd intercostal space. And then I'm gonna move to the right here, or down, palpate the aortic area. I'm gonna go back. I'm gonna go down to the other way and palpate the pulmonic area. Okay. And then we're gonna go down to the 4th intercostal. A little bit down further. And palpate the tricuspid area. And then we're gonna go out further, similar to where the PMI was, and palpate for the mitral or apical area. Okay. Palpate all those. Any pain or tenderness?
No.
I didn't feel anything abnormal there. And then I'm now gonna actually palpate for some other things, specifically in those areas, the same 4 areas, but I'm gonna be looking for heaves, lifts, and thrills. So the first thing I'm gonna do is the heaves and lifts, which is gonna be looking for any sustained impulses or any vigorous movement that might indicate there's something going on with the valves. And to do this, I'm gonna use my palm and touch those same areas.
Okay.
Let me know if I'm pressing too hard. So we're gonna go this way first, and then we're gonna go like that. Feel a nice strong heartbeat actually. I'm gonna go down to the pulmonary. My hands are cold, huh?
No, it's okay.
All right, we're gonna go back down to the sternal border. I'm gonna do the tricuspid. All right, and then we're gonna go over to the mitral. Okay. It's kind of hard, I'm grabbing inappropriate places. I'm sorry.
You're fine.
All right, and then we're gonna do the next thing, which is thrills. So this would indicate any turbulence, which could also indicate a valve abnormality. I'm gonna be feeling for buzzing in like this palmar region, not palmar, but upper part of my hand. I don't really know what to call that. All right, so we're gonna go down here. All right. I don't feel any buzzing. Well, that's good. Normally, this person would not have a bra on, so I would feel better, be able to have better palpation, I should say. I don't feel any buzzing there, so I'm gonna say there's no thrills. The next thing I'm gonna do is I'm gonna auscultate all those areas with my stethoscope while you're laying down.
Okay.
And then we're gonna sit up and do it again. And then we're gonna do it once more while you're sitting up with the other side of my stethoscope.
Okay.
I'm gonna start with the diaphragm. I'm gonna do the aortic area first. All right. I'm listening for those S1 and S2 sounds. We're gonna go down to the tricuspid area. Nice strong heartbeat, and then we're gonna go over to the mitral area. I think I'm a little too far actually. Yep, nice strong heartbeat there. Okay, now I'm gonna do the same thing having you sit up, if that's okay.
Yep.
All right.
Let's get closer to you.
Start the suprasternal notch again. Listening for S1 and S2. I hear the pulmonary side. We're gonna go right here. Nice strong heartbeat. And then we're going over here for the aortic, or the mitral valve. All right, I'm gonna hear all those beats. We're gonna do one more time, but I'm gonna use this part. I'm gonna have you actually stay sitting up.
Okay.
All right, same placement once again. I can hear different pitches this way. Actually, I'm gonna hold it like this. I can hear the okay, and then I can hear all of that. No abnormalities noted there. So the next thing I'm gonna do, even though I'm pretty sure we haven't learned this yet, is we're gonna palpate the carotid artery while I'm listening to your heart. And I would differentiate between the S1 and S2 sounds, but I'm not really sure how to interpret that yet, so I'm gonna do my best.
That's fine.
So I'm gonna have my stethoscope ready. I'm gonna use the diaphragm. I'm gonna feel for your nice strong pulse. Okay, same 4 areas. All right, I listened for the 2 sounds. They all sounded very similar to me. The next thing I'm going to do is auscultate the diaphragm in the aortic area, so the left sternal border in the aortic area down here. Sorry for my shirt. And so I'm going to have you lean forward a little bit,
Okay.
and then you're going to exhale out and you're gonna hold it.
Okay.
You're gonna go and kind of hold it like you're lots of air.
Okay.
We're only gonna
Let
do
me
the lower
know when
part.
you want me to.
Okay, you can take a big deep breath in and blow out, or exhale normally, and then hold it. All right. All right. And I'm still able to hear adequately. It sounds the same. So we're gonna do almost the same thing. I'm gonna have you lay down this time though. So we're actually doing the same exact thing, but this is just looking at the mitral valve instead.
Okay.
So you're gonna breathe out again and hold it.
Ready?
Yes. All right. Those sounded consistent as well. So there's one more test we need you to do, but I'm gonna wait until the end of our exam because I don't want to have you squat down on this table.
Okay.
So we're gonna wait a second on that.
Okay.
So next thing I'm gonna do is oscillate once again with the bell over your apical impulse on your left side. So basically what I'm gonna have you do is rotate onto your left side.
Okay.
And I'm gonna be looking for mitral stenosis. It's kind of hard for me to get to the
I think it was.
Hey, get on the video. The mitral area. So I need to get on this side. I'm gonna listen. With the bell. Okay. So then one more thing I'm gonna do while I have you on my table here is I am going to examine for jugular vein distension. So basically I'm going to have you lay flat on your back.
Okay.
And I need you at a 30-degree angle, so I'm gonna get some pillows and estimate 30 degrees because I don't have a fancy hospital bed. You can lay down, let's see. It's a slippery surface. Okay. I had a little stick out here. Here it is. So what I'm gonna have you do is turn your head to the left. And so I'm gonna look for your jugular vein pulsation. And I'm gonna place a flat object on it once I note it. Okay. Actually, okay. About that far. And then I would measure how many centimeters it is above the sternal angle, which is down here. If I had to estimate, while I do have my tape measure.
I was gonna say, do you want me to hold something?
No, I'm just gonna estimate. I can do. I would say it was at least 6 centimeters. It was out like this. It didn't look super long to me, so I'm gonna guess it's under 8 centimeters, which is in normal expected conditions. So I think we're gonna go with it was about 7 centimeters. Sound good?
Sounds good.
That's what I'm gonna chart, because that's what it was, exactly. You only do accurate charting here. Okay, so I'm gonna have one more test for you. I'm gonna have you get down safely off my very nice exam table.
All right.
So what I'm gonna have you do is I'm gonna have you squat down And I'm gonna oscillate again, and they all 4 regions. And then I'm gonna have you stand up and do it again. This is looking for mitral valve prolapse and potentially aortic stenosis,
Alright.
which I'm sure you know what that means.
So squat down like catcher's position?
Sure, yeah. If you have good knees, do you feel comfortable doing so? I guess I should.
That's fine.
Okay. Gotta have some good balance here. Be quiet so I don't muffle the voice. All right, S1, S2. Okay, you can stand up. It's probably the most.
Hey, it's okay. She's okay.
Mer, please stop. Merlot, I can't hear. Please stop. Okay, and then one more. Okay. All right. So that concludes our exam today. Do you have any questions or concerns?
No, I don't.
Okay, I'm gonna go discuss my findings with PHR. Sorry, my animals are interrupting. Thank you so much.
Thank you.